In this presentation, I will talk about the tooth extraction step-by-step procedure. In general, if we want to extract a tooth, we should do 6 steps. The first step is the diagnosis procedure, the second step is the anesthesia procedure, the third step is the correct dentist and patient's position, then the luxation of the tooth, and then the traction and final extraction of the tooth. And finally, and after all of this, we should do the post-operative checking and instructions to the patient. The first step, which is the diagnosis step, in which we will take the complete dental and medical histories from the patient and specifically asking him about any diseases or illnesses that he has, for example, diabetes, mellitus, or a hypertension, or any drug that he has, and then evaluate if these drugs or diseases will interfere with our surgery. Then we do a clinical examination, and then we use the diagnostic aids, for example, the radiography, and then we will evaluate the indications and contraindications for this case and to make the final diagnosis about this case. In general, the indications for a tooth to be extracted are operative related things, for example, the extensive caries that reaches the root, the severe periodontal disease when there is an advanced bone loss and tooth mobility, or finally when the endodontic treatment is impossible, for example when there is an internal root resorption that is very advanced, or for example a primary tooth that has an external resorption that is so advanced. And surgery related things, for example the supernumerary teeth, the impacted teeth, the presence of a lesion around the tooth, or in the case of the road traffic accidents when there is a tooth in a fracture line, and before radiation therapy, because if we extract after the radiation therapy we will have death in the bone, and that is called as an osteoradionecrosis. Or other disciplines of dentistry related things, for example the orthodontic or the prosthodontic treatment plans, where there is a non-strategic tooth that must be extracted to conduct the orthodontic or prosthodontic treatment. And finally, the financial reasons. This is a thing that you will face it, and it will be the most unpleasant situation that you may face in your oral surgery clinic. Anyways, the contraindications for tooth extraction are not absolute contraindications, but they are temporary and related to a specific situation. For example, if we have a local disease like pericoronitis, we should resolve that thing, then we do the extraction procedure. If we have uncontrolled systemic disease, for example very high hypertension or blood glucose level, we should control these situations and then do the extraction procedure. That was the first step in the extraction procedure. The second step is the anesthesia procedure, in which we will infiltrate the upper teeth by inserting the needle in the fornix or the vestibule that is above the tooth. And I want to indicate here that the posterior teeth, specifically the molars, the 7 and 8 teeth, should be infiltrated by palpating the vestibule, the buccal vestibule. If you now insert your index finger in your buccal vestibule, upper buccal vestibule, you will feel that piece of the zygomatic bone that is above the maxillary 6 or maxillary first molar. If you palpate it, you will notice it, and the right infiltration for the upper first, second, and third molars should be behind this piece of the zygomatic bone, except for the mesiobuccal root of the maxillary first molar that should be infiltrated in the upper second premolar area. Also, we should anesthetize the nasiopalatine and greater palatine nerves according to the teeth that are present, and that is by infiltrating the area between the mid-palatine suture and the intended tooth, the middle part of this area. Or for the lower teeth, we should do a block for the inferior alveolar nerve, and that is by inserting the needle from the opposing side from the premolar area. If there is no premolars and that was an elderly patient, you should predict the area of the premolars and the height of the premolars and insert the needle from that direction, as you can see here in the right picture. This is the vertical height of the needle. On the other hand, the horizontal direction of the needle will correspond to the following. Guys, you should palpate the anterior border of the ramus of the mandible by your thumb, as you can see here in this picture, and put your needle 1 centimeter behind that anterior border of the ramus of the mandible. Okay, so that now you have the horizontal and vertical directions for the insertion of the needle to block the inferior alveolar nerve. And by inserting the needle a little bit lingually, you will anesthetize the lingual nerve, and by inserting the needle near the cervical area of the lower 7 or lower second molar, you will anesthetize the long buccal nerve. After that, you should know the correct dentist and patient's position. The patient's head should be with or below the level of the dentist's elbow. The patient's jaws, the upper jaw should be in a 60-degree with the horizon, as you can see here in this picture. The maxillary teeth are in a 60-degree with the horizon. The lower jaw, when we extract the lower teeth, the lower jaw should be in a 0-degree with the horizon or parallel to the floor. Okay, so that when we extract the upper teeth, they should be with a 60-degree with the horizon or the floor, and when we extract the lower teeth, they should be parallel to the floor. The dentist position generally is in front of the patient, but we can stand behind the patient when we want to extract the lower right quadrant teeth. And the opposite hand function is always to support the head or the jaw and reflect the soft tissues. As you can see here in this picture, the left hand is supporting the maxilla and the maxillary alveolar ridge and reflecting the cheeks. Okay, and after that we should do the most important step in the extraction procedure, which is the luxation. Guys, the luxation is the most important step during your extraction procedure. Before doing the luxation, you should check the anesthesia and then separate the gingiva by using the probe or an elevator, and after that you will face two conditions: malleable teeth or not malleable teeth. Guys, when I say malleable, I mean the tooth that is not stiff and that can be luxated by normal forces. Okay, that is the malleable teeth. But the not malleable teeth, that is the stiff tooth that cannot be luxated by normal forces and should be extracted by the surgical technique and by the separation of the tooth if it is a multi-rooted tooth. But in general, the malleable teeth are the teeth that I will talk about in this presentation, and they are the teeth that will be extracted by the non-surgical tooth extraction procedure. When we have a malleable tooth, the dissection is done primarily by using a small straight elevator and inserting that small straight elevator in the interdental space between the intended tooth and the adjacent tooth, and by pushing the intended tooth and luxating it. Okay, as you can see here in this picture, we insert the small straight elevator in the interdental space and push the tooth to luxate it. When we do this, we will have one of these four cases. The malleable teeth are either with a crown and an adjacent tooth. As you can see here in this left picture, the tooth has a crown and has an adjacent tooth, so that the luxation in this procedure is by inserting again and for the third time the small straight elevator in the interdental space and pushing the tooth, the intended tooth, to be luxated. As you can see here in the direction of the arrows, they are pushing the tooth, not other forces, because if we do other forces that will affect the adjacent tooth. So that concentrate here that you should push the intended tooth and then it will be luxated. The second case of the malleable teeth is when the tooth has no crown but there is an adjacent tooth. In this situation, we will concentrate on the apical pushing forces. As you can see here in this middle picture, we insert the small straight elevator apically in a wedging fashion to act like a wedge that will displace the retained root or the crown or the tooth that is without a crown, and then after that wedging forces, the tooth root will be luxated. The third case or situation for the malleable teeth is the tooth that has a crown but has no adjacent tooth. As you can see here in this right picture, the tooth has a crown but has no adjacent tooth, so that there is no interdental space to insert the small straight elevator into. But in this situation, we will rotate the tooth, as you can see here in the direction of the arrow, and take it out from a socket by using the interdental septal bone as a fulcrum for that rotational forces. Okay, or simply by grasping this tooth with the forceps and moving it with some slight forces that will luxate the tooth too. Okay guys, the fourth and last case, which is when there is no crown and no adjacent tooth. In this situation, the luxation procedure is done by using the apical pushes, lateral pushes, rotational pushes, or if all of these pushing forces were not applicable, we shift and do a surgery for that tooth by opening a flap, removing a bone, and making a purchase point, then retraction of the tooth. And after the completion of the use of the elevator to laxate the tooth, guys, we should insert the forceps apically as much as we can, because pushing the forceps beaks as much apically as we can will prevent the root fracture, specifically the apical part of it. Then after that we push buccally for several seconds and lingually for another few seconds. These pushing and pulling forces for the tooth will tear the periodontal ligaments and crush them. After that push-pull movement, we will do a figure 8 movement to further laxate the tooth. Okay guys, after this the tooth should be laxated and ready to be tracked, leading us to the fifth step of the tooth extraction procedure, which is the traction. The traction is simply done in a occlusal and buccal direction, or generally not the buccal direction, but you should feel where the tooth leads you, because sometimes the roots are curved, and if you push or tract the tooth occlusally and buccally, it will lead to a fracture. So that you should feel the tactile sensation of where the tooth leads you during its extraction, and follow that sensation and follow that wooling of the tooth and extract it accordingly. But in general, the traction procedure and final extraction procedure of the tooth is done occlusally and buccally. After the completion of the extraction procedure, we should do the post-operative checking and instructions. We should check the tooth if it is complete or not. We should check if it has a disease or not, a periapical lesion that should be curated or not. And also we should check the bone if it has a sharp ridge that should be corrected by a file or anything else. And then, and most importantly, we should do the instruction procedure to the patient, which are divided into 3 parts. Instructions during the following half an hour, during the following day, and during the next 7 days. During the following half an hour, as you can see here in this picture, the patient should put a gauze in the area of the extracted tooth, correctly as in picture C, not as in picture B. Okay, and during the first day, the patient should apply no negative pressures in his mouth. The negative pressures are produced when the patient smokes, when the patient sucks a straw, and when the patient sneezes, or anything that will apply much pressure in his mouth and oral cavity that will pull the clot from its place, leading to the most common complication after tooth extraction, which is the dry socket. So that you should instruct the patient to avoid any negative pressures in his mouth, and he will always, most of the patient will immediately ask you, what can I eat and drink? Because people does not think only about these 2 things. So that you should tell them that they can eat and they can drink, but only soft foods and cold drinks. After that, you should tell them to take their analgesics correctly and before the effect of the anesthesia dissipates. And if it is a surgical extraction or a tooth with a lesion, they should take an antibiotic. Okay? And finally, during the next 7 days, the patient can gargle with a warm water and salt and brush smoothly. These are the instructions that the patient should follow during the next half an hour after extraction, the next following day, and the next 7 days after the extraction procedure. Thank you for this nano construction of the web. By listening to this presentation, always try to know, always try to spread knowledge and construct the world. Be kind to one another because life is not short but it is limited, and that is for the greatest benefit to the humankind.